Well, and you think of in the hospital setting, if they did any clinic work, hospital work, they always have a team. So you might be the only nurse on call, but you can still go talk to someone down the hall. Like you said, you're kind of in your own little bubble here. Mm-hmm. So just having you to call and ask for support is just tremendous.
Yeah.
And I know we've touched on this a little bit, but can you talk a little bit about the inside of the building and how this impacts the school staff day to day with having the support of Avel?
Yeah. So there was a study out. I'm not sure when the study was done, to tell you the truth, but it showed that having a nurse in your building saved 20 minutes a day for teachers and 40 minutes a day for administrative staff. And so you multiply that times the number of teachers that you have. It allows people, our educators, to do what they're trained to do, to be educators instead of trying to do healthcare. And so I think that's one of the ways that we really make a difference.
Yeah.
But it's even keeping the kids in school. So yes, the kids learn better when they're in school, but when they are absent, that educator has to do all the makeup work, pull everything together so that the student, when they come back, can make up the work.
Yeah.
That takes a lot of time.
Yeah. A lot of time. I just think of when we'd go on vacation for a day or two and the amount of time that we would prep to go on that and everything else that goes with it. Yeah, it's crazy. So that's great examples of how the impact of this happens inside the building. But let's even go further and look at outside the building, within the community and the parent relation and how this impacts them. With having a school nurse in the building, what does that impact benefit them versus not?
Yeah, and so it makes it so that they can stay at work. They can feel secure that their children are safe.
Yeah.
And again, when we do those assessments, we do a follow-up call. We don't just see the kid and then not let the parents know what's going on. We let them know what's going on so that we can say, we looked at your child's, example would be an ear. We looked at your child's ear. They don't have a fever. Their ear doesn't really look red. We gave them a warm pack for comfort. It might be related more to fluid or allergies. We're uncertain, but we think that they can stay in school. You don't need to miss work.
Yeah.
Now, you can if you feel like, that's an appropriate thing to do. But when you think about many of these, the rural settings especially, but it's even true of the urban settings, it might take a half an hour to get back to the school from where you work, and then it's going to take another half hour, an hour to get to the doctor.
Yes.
And then it's going to take more time. So you've missed at least a half day of work.
Yes.
Now, there's times that is appropriate, but there's times that can wait. But that can only wait if you know what we're seeing.
Absolutely.
If you know what's happening with your student.
Yeah, absolutely.
And I think, too, when you think about, if there's an unlicensed person that's making those assessments, they can't make the assessment, so the parent just needs to come.
Yeah.
And so we allow the parent to have better information so they can make their best judgment.
Absolutely.
And we actually have had situations where parents had their kids at a school that had a health aide that they called a nurse. And then we came in to help support the health aide, and they were like, "That's not a nurse?" And we're like, no, it's not a nurse.
Oh my gosh. Yeah. See, and I don't think that's ever understood, because coming where I came from too, we were a very rural school, very small, but we had a school nurse that was there 24/7.
You were from Minnesota, right?
I was from South Dakota.
Oh, you were?
Yep.
Where were you?
Tri-Valley.
Oh, okay.
But it's like that I always had, and it was two of my students, I think it was their aunt. That was our school nurse, but we had one every single day. But then I have other friends who are like what you were saying. I bop around to 3 different schools within this little area, but it takes me 45 minutes to get to each one. So I stay one day here, one day there. I just don't think people understand that.
I think sometimes too, they also don't understand what a nurse might catch. Like in your instance, or like the kid with the stomach ache,
Absolutely.
There's a level of assessment that happens that really says, hey, something's not right. And so a parent might not think about that or to go to the doctor, or might not even be aware.
Yeah.
We had a kid that we did a vision screening on. 1 year his vision was 20/20. The next year it was like 20/200. And I was like,
What?
I thought he was faking it.
Yeah.
I brought him back in. I tested him again. I called the parent. I'm like, I think you need to take him in. I just don't know. He had a tumor on his eye.
Oh my goodness.
And so I think that people we don't think about that.
No.
This is a well-child environment, is typically what a school is. And yet, so many times the nurse is that first access to healthcare that student will have. And they catch it. You know, they catch the going to the bathroom a lot to call the parents and say, hey, we have noticed this, that they go to the bathroom a lot. I don't know whether you've been noticing it too, that they've lost weight. Yeah. This can be a sign of diabetes. It might be worth to take them in.
Yep.
You know, all those little pieces.
Well, I just even remember, I don't remember the story exactly, but you were telling me about they felt like they were having anxiety and it ended up being, was it a heart condition or what? Yeah.
Yeah, we had a kid at really remote school.
Yeah.
We listened to the heart, and the heart was beating 170 to 200 beats a minute.
Oh my gosh.
Nobody could have even felt that. There's no one on site that could have felt that. They're 60 miles from a hospital. It would feel like anxiety, but they had Wolff-Parkinson-White syndrome, and that was what it was diagnosed from that start. Yeah, it's amazing.
It's absolutely amazing. Well, and just to hear all of the different stories and the unique situations your team has experienced, it's wild.
We had a student that was saying, like, I feel like there's something in my ear, like it feels kind of tickly. Yeah. And so the nurse looks in the ear and she goes like, ah! And the kid goes, ah! Because there was a bug in his ear.
Oh my gosh.
And on our screen,
the bug's
looks huge. You know?
Yuck.
So, no, thank you. Thankfully, it crawled out on its own. But otherwise, it would have been a doctor visit because nobody could poke in tweezers. No, we don't do that. Or our other funny thing that we always are like, when a kid comes into the office and says something like, I think I might have an eraser in my ear. And you're like, you think?
Or
Who put that eraser in your ear?
Exactly.
Well, you put the eraser in your ear.
Oh my gosh.
And then you look, sure enough, there's a eraser in the ear. I had another kid that said, I think I have rocks in my ear. And I was like, I was earlier in my virtual nurse career, and I was like, you don't have rocks in your ears. I should have known.
He had rocks in his ears.
Sure enough, he has rocks in his ears.
Oh my gosh.
I was like, how did you get rocks in your ears? And he's like, my brother put them there. You're right. He did.
Well,
Okay.
I remember one of the episodes of House, the little kid kept putting these miniature figurines up their nose, but it was for attention. They weren't getting attention, and that was the way to get attention. So they kept coming in, and every time they kept a little collection off to the side of the 9 figurines that he had stuffed up his nose.
And it's a developmental stage.
Yep.
Where young children are like, oh, what's this orifice?
Gotta test this out.
What's this orifice? And they just put things there for God knows why. We don't usually ask, why did you do that? We're just saying, like, tell me about that.
Yes. And maybe let's not do that again. Yeah.